Dr. Steve talking about squatting. Now I'm going to digress a second and show you a position and show you why understanding what's going on in your hips is important. So if you sit into that little bit more of an advanced position like this, right? You need to keep your foot flat, but this can put a lot of pressure on the hip joints. So getting into this position can be problematic if on examination you have very poor internal rotation of your hips, and if when we scoured the hip, when we brought that knee in and rotated it around, if we have pain, we're gonna have to hold off on this position. But if you're in this position, I wanna keep my foot flat. I can use my elbow to drive my knee out and work on that mobility, again, gently prying, kind of like you're trying to take something out of the ground. You're prying it out, and then I can sit back, so there's very little distance between my buttocks and the ground, and then I can rotate this, but from the hip joint. So I'm rotating it, and that can add range of motion. I want to hold my chest up, my rib cage up toward the ceiling. I'm going to rotate at the hip joint, not just wiggle my foot, rotate at the hip joint. So if I bring this to the side here, and I show you here, I'm going to come out, I'm going to sit back, I'm going to think long in my leg, I'm going to rotate as I'm gently pushing this out. All that being said, first assess your hips and see if it's even safe to start to get in that position.